Welcome to the Specialized Resident Care and Safety Training, provided by Vagtal's Residential Care Center. By the end of this video, you will be able to perform safe transfers and feeding, ensure medication safety, recognize a change in condition, and understand vital signs and body checks. We will also cover the Fatal 6 prevention, infection control, behavioral safety, emergency response, documentation, and your staff responsibilities. Specialized resident care is individualized. It requires additional training, skills, or monitoring to safely meet a resident's specific health, behavioral, or safety needs. Our focus is on safety, dignity, and independence. Vagtal's ensures residents receive safe care, staff are properly trained, and care follows the resident's service plan. We identify and correct health and safety concerns and ensure services meet all state requirements. Person-centered care means respecting residents' rights and preferences, using the least restrictive interventions, and encouraging independence when safe. Always maintain privacy and dignity at all times. Vagtal's focuses on care based on the resident's choices, needs, and goals. We support independence and follow the individual program plan, ensuring staff adhere to HCBS person-centered requirements. Now let's begin the section on safe transfers. Safe transfers are critical to prevent resident injuries and falls, prevent staff back and shoulder injuries, and ensure compliance with care plans and Title 22 regulations. Always check the resident's transfer level. Use proper body mechanics. Bend your knees, keep your back straight, and avoid twisting. Never guess. Use assistance when required. Our focus areas for safe transfers include bed to wheelchair, wheelchair to bed, wheelchair to toilet, and toilet to wheelchair. The learning objectives for this section are to understand proper body mechanics, learn step-by-step procedures for safe transfers, identify when assistive devices are needed, and prevent injuries. For general transfer guidelines, start with preparation. Wash your hands, explain the procedure, lock the wheelchair brakes, adjust the bed height, and place the gait belt if appropriate. Always use proper body mechanics. Keep your back straight and knees bent. Never twist. Pivot with your feet. Keep the person close to your body and use your legs to lift, not your back. For bed to wheelchair transfer, position the chair parallel to the bed and lock it. Help the resident sit up, use a gait belt, and place your knees against theirs. Stand and pivot together, then gently lower them into the chair. To transfer from wheelchair to bed, position the chair at a 45-degree angle and lock the brakes. Ask the resident to scoot forward. Use a gait belt and pivot toward the bed, lowering them gently and assisting them to lie down. For wheelchair to toilet transfer, position the wheelchair next to the toilet, lock the wheels, and remove the footrests. Use a gait belt to assist standing and pivoting onto the toilet seat. Ensure privacy and remain close if they are unsteady. To transfer from the toilet to the wheelchair, ensure the chair is close and locked. Assist them to stand, using grab bars or a gait belt. Pivot slowly, lower gently into the seat, and assist with hygiene before securing them for transport. Safety reminders for transfers. Never lift alone if the person cannot bear weight. Watch for fatigue or dizziness. Use a Hoyer lift or sliding board if needed. And keep the environment clutter-free and dry. Do not attempt to use a mechanical lifting device unless you have been trained. Gather supplies including the mechanical lift, sling, wheelchair, and any ordered restraints or blankets. When using a mechanical lift, first prepare the bed and lock the wheels. Lower the side rails and fold the linens. Position the person on their side. Place the sling between the shoulder and knee and secure the lower edge under the knees. Then, position the lift over the person and attach the sling to the swivel bar and cross arms. Once lifted, follow the remaining steps for movement and transfer as outlined in the procedure, always prioritizing safety and clear communication.
The next segment focuses on fall prevention.
Our objectives for fall risk management are to identify resident-specific risk factors, recognize common causes of falls, apply interventions and safety precautions consistently, and understand staff responsibilities. A high-risk resident often has a history of falls, weakness, and unsteady gait and requires assistance with transfers. They may use mobility aids and take medications that cause dizziness or sedation. Fall prevention is vital because falls can lead to injury, hospitalization, loss of independence, and reduced quality of life. It is a team effort where every staff member plays a role. Common causes of falls include muscle weakness, poor balance, dizziness from medication, rushing to the bathroom, poor lighting or clutter, improper use of mobility aids, and cognitive impairment. Environmental interventions for high-risk residents include keeping the room clutter-free, ensuring the call light and personal items are within reach, keeping the bed low and locked, providing non-skid footwear, and using adequate lighting. For mobility safety, use a gait belt for transfers and encourage the use of walkers or canes. Never leave a resident unattended while standing or in the bathroom, and ensure mobility aids are always within reach. Monitoring includes frequent safety checks, using bed or chair alarms if ordered, and observing for signs of dizziness. For toileting, offer scheduled routines to prevent rushing, and keep the bathroom accessible and well lit. As a team, report unsafe situations and document all near misses and falls. Follow the care plan, stay with the resident during transfers, encourage them to call for help, and report any hazards. Remember the quick safety reminders: call, don't fall, stay close, stay safe, and check, lock, support. Falls are preventable. Your alertness and teamwork can protect our residents. Consider the scenario of John, a high-risk resident with poor balance and impulsive behavior, attempting to walk to the kitchen without his gait belt while objects are on the floor. What should you do immediately? The correct response is to approach John calmly, prompt him to sit, use his prescribed gait belt, clear obstacles, and provide hands-on assistance. Always document the incident and follow his individual service plan.